The campaign, based on the report, has made significant progress towards implementing the Future of Nursing report. We see tremendous progress that's been made, and it has galvanized the nursing community. It has had a catalytic effect, which we found to be enormously positive. And in many areas, it met or exceeded expectations. Moving forward, however, the committee felt in its deliberations that it needs to engage a much broader network of stakeholders, and specifically focusing on 4 areas, and it's in those 4 areas that we're going to present conclusions and recommendations, and those are scope of practice, education, diversity, collaboration and leadership, and finally, data. So to summarize that, we think the first 5 years has been enormously successful, and it has been appropriately, largely inward-looking to galvanize nursing, the nursing community. In the next 5 years, because of the success you've already had and because of the changing context of healthcare today, we think the effort needs to be more outward-looking and more engaging of broader constituencies to get it to the next level. So I'll go through these 5 areas. In each area, we'll state some conclusions and then the high-level view of the recommendations, which are in much more detail in the full report. So in the areas of removing barriers to practice and care, the conclusion that the committee drew was that continued work is needed to remove scope of practice barriers. The policy and practice context has shifted since the Future of Nursing course was released. That is shifted to a more team-based approach. And this shift has created opportunities for nurses, physicians, and other providers to work together to find common ground in the new context of healthcare and to devise solutions that work for all professions and all patients. So the recommendation based on that conclusion is to build common ground around scope of practice and other issues in policy and practice, should broaden its coalition to include more diverse stakeholders, build on its success, and work with other health professions groups, policymakers, and the community we serve to build common ground for removing scope of practice restrictions, increasing interprofessional collaboration, and addressing other issues to improve healthcare practice in the interests of patients. In the area of higher education, improving education at higher levels of education, we actually had our most recommendations, and we spent a lot of time on this area, which we think is exceedingly important. So the conclusions are that we need to be mindful of unintended consequences. We shift the population to an increasing baccalaureate. We need to be sure that there are an unintended consequence of the remaining nurses without baccalaureates, what roles they're going to play, and also that we not create barriers to entry to nursing. Very important point. That we need to look much more closely at the evaluation of the transition to practice residencies, which have begun to prove their value, but we need much more data on it and what the effect of these programs are on patient outcomes specifically. Additional efforts are needed to clarify roles of PhD and DNP nurses to fully utilize them, particularly in teaching and research. And in the current healthcare context, interprofessional continuing education is more important than ever. So the recommendations that follow from these conclusions, that we need to continue the pathways to increasing the percentage of nurse with baccalaureate degree. This has moved the needle, but as everybody knows, this was probably the most ambitious stretch goal. And while we've moved the needle, we still have a long way to go. The campaign, nursing education community, and state systems of higher education should continue efforts to strengthen academic pathways for nurses towards a baccalaureate degree, both by entry-level baccalaureate and by continued baccalaureate completion program. The committee felt very strongly that both are needed, both need to be strengthened. Strengthening alliances between community colleges and universities is all important, and being sure of the value and quality of these expanded and new programs is also important. The second recommendation in the education field is to create and fund transition to practice residency programs. The campaign, in coordination with healthcare providers and healthcare delivery organizations and payers, should lead efforts to explore ways of creating and funding transition to practice residencies at both the registered nurse level and advanced practice levels. We feel there is evidence of value to these programs, both to the nurses and to the institutions, but we think a lot more evidence is needed. We still do not have a clear model for these programs. There are many different models. The model for the registered nurse is almost certainly different from that from the advanced practice nurse. So much more effort needs to be given to develop models and evaluate models. The third recommendation in the education field is to promote nurses' pursuit of doctoral degrees. We note that much progress has been made in this. The progress has been much more in the DNP than in the PhD. We think both are needed, but probably more emphasis needs to be placed on the PhD. And we need to be sure that we have an adequate supply of nurses in these doctorally prepared roles to assume the leadership roles that are needed in clinical care, education, and research and practice redesign. It is these doctorally prepared nurses that we think will emerge and must emerge in these leadership roles. And we need to prepare them specifically for faculty roles and for leadership roles in a variety of settings, not just in the acute care setting. The fourth recommendation in the education arena is to promote interprofessional lifelong learning. And here, the nursing profession should work with the other health professions, which have the same challenge of ongoing interprofessional development and education. And this should be a joint effort across the professions. There are great opportunities to do interprofessional work in continuing education across the professions. In the area of promoting diversity, the conclusions were that by making diversity one of the pillars, the campaign has shown a spotlight on the issue of diversity in the nursing workforce. The community college, associate degree programs, and baccalaureate completion programs provide important pathways for diverse and disadvantaged students to enter the nursing professions, and these educational pathways need to be maintained and strengthened. And that high proportions of underrepresented minorities among among LPNs and LVNs in other health occupations requiring less education than RNs provide a potential pool of candidates for a more diverse workforce, that is, to advance them into the nursing workforce. So the recommendation that followed from these conclusions is to make diversity an even higher priority, to continue to emphasize recruitment and retention of a diverse nursing workforce, and make it a major priority in the national campaign and state action coalitions, including giving numerical goals and targets to work towards. In the area of collaborating and leading change in healthcare delivery redesign, the conclusions were that true interprofessional collaboration can be accomplished only in concert with other health professionals, not within nursing alone. And here again, reinforcing that message of looking outward and not just inward. To assess progress on leadership development, it is necessary to track programs and courses in leadership, entrepreneurship, and management in which nurses are participating. We want to emphasize both within nursing schools and within many other professional schools. Encourage and promote nurses to be in business schools, to be in law schools, to be in other professional schools as well, not just an important role for nursing schools to do it, but it's not just nursing schools that these leadership opportunities and training should exist. More attention is needed for nurses serving in leadership positions other than on private boards, which has been what has been tracked. We need nurses in many, many other leadership positions and should be tracking that. And for the campaign to progress further, the communication strategy needs to expand beyond the nursing profession to the other stakeholders. This is a recurrent theme and probably the strongest message that we came out of this intense study with. So the recommendations that follow from this are that we need to expand efforts and opportunities for interprofessional collaboration and leadership development for nurses. As the campaign broadens its coalition, as in Recommendation 1, we should expand its focus on supporting and promoting interprofessional collaboration, opportunities for nurses to design, implement, and diffuse collaborative programs in care and delivery. Nurses can and should lead these efforts, not always, but often. Interdisciplinary development programs that focus on leadership, and here again talking about the importance of nurses getting leadership training in a variety of settings in a variety of schools. The second recommendation in this collaboration theme is to promote the involvement of nurses in the redesign of care delivery and payment systems, to work with payers, healthcare organizations, providers, employers, and regulators to involve nurses in the redesign of care delivery and payment systems. And here's where we see the importance of having nurses in leadership role in many different kinds of organizations. And that should be one of the things that is tracked. And then finally, to communicate with a wider and more diverse audience to gain support for the campaign objectives. Again, this message of being outward-looking, more stakeholders, more allies in the other health professions, as well as in the community at large that we lead. Community leaders need to be recruited, and I know they are to some extent, but even more to get the community-wide leadership behind these efforts. Finally, in improving the data infrastructure, the conclusions were that greatest progress has been made in expanding data collection within but not across the health profession. So each of the health professions has looked inward to work on its own data. We're not going to understand the general picture of the workforce to serve the public unless we do this again across the professions and improve and strengthen the data collection. Opportunities will increase for the use of data from the Centers of Medicare and Medicaid to assess service provided by APRNs, but only if they are able to bill under their own NPI. And finally, conclusion that significant progress has been made on accelerating uptake of the minimal data set for the collection of data on the supply, demand, and education of nurses among state nursing workforce centers. So the conclusion that, or the recommendation that comes from this is that the campaign, and again, the campaign can use its influence to promote collaboration among many organizations, or many organizations within nursing and outside of nursing collecting data, but it's not at present well coordinated. We lament the absence of the National Healthcare Workforce Commission, but given its absence, we need the power of the coalition to bring together all these disparate data sources, to make sense out of them, and to create the partnerships to improve the quality of the data so that we better understand the nursing workforce of the future and how it interdigitates with the rest of the healthcare workforce of the future. We are very heartened by what we found. I think enormous progress has been made, but we see much more opportunity ahead and to take advantage of the changing world, the changing context of healthcare that was anticipated in many ways by the report, but which has played out in ways that we couldn't have entirely anticipated, and that calls for, in part, some changes of strategy to take advantage of this changing context.
We've looked at the landscape. We have an external board. We've really trying to really focus on what are some of those first steps you would look at in an interprofessional strategy.
A lot has gone on in the last several years, as many of you know, in changing the paradigm of the pre-licensure education for health professionals. And I think we're going to be producing, I hope we're going to be producing, a next generation of health professionals that are beginning to be acculturated as health professionals along with the other health professionals. I think we need to take advantage of those movements that are going on in the schools around the country, and some are leading, some are ahead of others. We've been fortunate at the Macy Foundation to support a number of these initiatives. Find out where they exist and get the leading edge on board. Those people that have already experienced the advantage of interprofessional education and collaborative practice. The National Center in Minnesota that was created by a partnership between HRSA and 3 private foundations, and we have some people from the National Center here, has been a wonderful catalyst for these interprofessional and collaborative practice opportunities. There are now a dozen or more what we call incubator sites across the country that are doing projects in collecting data on interprofessional education and collaborative practice. So I would say the first place to start is where it is already starting, and recruit those leaders, and then they can recruit others on board.
My question is, NSNA is really where this pipeline begins for getting students prepared to serve on boards, and it's a fantastic experience. The question and conversation that I want to carry to the rest of the student body is painting a more clear picture of what happens after NSNA. A lot of my conversations with our colleagues so far has been about moving forward on boards and serving on boards and volunteering within the nursing community. But what does it look like for students or new graduates to reach out to other opportunities in the professional world? Is there a clear next step for us to take, or should we spend more time within the nursing profession to understand the conversation and the issues more?
Good afternoon, and welcome. I think that one of the opportunities, especially for young professionals beginning, is to not only look at your professional organizations, but also look in the community and your opportunity to participate in community boards. Many community boards have junior boards that allow for people who are not really necessarily ready for a full board experience to have an opportunity to learn about participation in boards, fundraising, community service. And so I would recommend that you not only look at professional organizations, but also look at community opportunities.
I wanted to bring to your attention and ask you a question about distance learning, because the Frontier Nursing University, which is the first nursing university that I know of in the country, in the past 5 years has graduated 638 nurse midwives, 912 family nurse practitioners, 155 women's healthcare nurse practitioners, and granted 176 Doctor of Nursing practice degrees. Now, this is all done through distance learning, so I would like to know your impressions of the role. And in addition to all these many kinds of degrees that have been granted and students who have completed courses, about 78% of them are from rural areas, and that is a problem to educate nurses to be in rural areas. But this enables people, nurses who live in rural areas, to go ahead and get their higher degrees.
It is extremely important for distance learning programs to provide broader access if we're going to address not only the diversity of the nursing workforce as far as diversity, ethnic diversity, but also diversity in how and where we deliver nursing care. I think these distance learning programs provide an opportunity for that others wouldn't have under normal circumstances. So I think it will continue to play a very important role in the future.
One of the most critical things to actually improve healthcare is to eliminate barriers to the use of advanced practice nurses. And then it takes a broad coalition of folks to be able to do that. One of the communities that so much need the help of advanced practice nurses to accomplish their objectives for better health is the men and women who have borne the battle, our veterans of the United States Armed Forces. And for a period of several years, the U.S. Department of Veterans Affairs and now some 60 members of Congress and the AARP and many nursing organizations have gathered together in support of recognizing APRNs to their full practice authority in the VA, not because it's a good idea for APRNs, but because our veterans must not be required to wait anymore for the care that they are owed and that they deserve. There is something that people can do about it now. There is a coalition that is inspired by all this effort, titled the Veterans Access to Quality Healthcare Coalition. It is at veteransaccesstocare.com. People can go to that with their smart devices even now and register themselves and their friends. It's not done until it's done. What the VA needs to be able to do is to publish a rule to complete this work, to make this great idea the law. And what we ask you is, one, to be aware of this effort, and second is any further counsel that you have to, as you have advised, expand the realm and number of people who are interested in and engaged and invested in this idea of ensuring care for our veterans.
I support you, Straw, as a former VA chief of medicine.
Yes, sir.
And as a decade-long chair of the Special Medical Advisory Group of the VA, I totally endorse this. I think the VA has, in fact, been a wonderful model for collaborative practice.
Yes, sir.
And we need to continue to support it in that way. I agree entirely.
Many of the recommendations are about teaching, educating, and moving our future students. However, we have a huge faculty shortage, and much of the education and training is on the back of PhDs. And so as was very eloquently presented, we really need to focus on the PhD. We know that degree is very challenging, and really we have kind of flatlined as far as growth. Lots of growth in the DNP. So what is it that our campaign is doing to address this really heavy burden that we as PhD and faculty and academes are doing to address, relief and, to move our mission forward and address the recommendations?
In the report, you will note that there was an emphasis on focusing on increasing PhDs, continuing the focus on increasing PhDs, but there was also an opportunity for us to look at doctorally prepared nurses from different programs like education and other areas, as well as preparing DNP graduates as educators. And so looking at not only increasing the number of PhDs, but also increasing maybe our thought about what an educator will look like in the future as far as a doctorally prepared educator. I also think that there was a lot of conversation among the group about one strategy for increasing PhD numbers would be to start to encourage nurses to pursue PhD degrees earlier in their careers. It appears that it becomes something that we do in the older years of our tenure as nurses, and starting to encourage nurses to think about the PhD earlier in their career is another mechanism for getting us to that point.
My gratitude towards you is the fact that you've used the word priority in terms of paying attention to diversity. And simply, I'd like to get some insight into why your choice of that word, and what were you thinking about in terms of evidence that will show that diversity has become a priority for the discipline of nursing and its future?
The committee felt that while there has been clear progress, and if you look at the absolute numbers of Black African American and Hispanic Latino graduates, and even in practicing in nursing, the numbers are up significantly. The percentage of graduates has not grown as rapidly because of the overall growth in enrollment in the nursing workforce. We felt that, again, while progress was being made, that clearly we needed to do more, and there were a number of, we felt that the campaign can really provide leadership in this area. We recommended that we do more to annually produce data and performance data at the state level, and in general showing what progress that is being made and where the progress is being made. We think doing that sort of report card on an annual basis will help motivate, keep the focus on diversity. We also think that there's really a need to bring together groups to try and identify what are the best strategies. And there's been a lot of discussion, been a lot of experimentation. We think that nursing, along with other professions, can really try and focus in on what are the best strategies, what works and what doesn't work. And again, we think by keeping attention on the issue and identifying effective strategies, we can move the needle further and make greater progress in the future. Again, we just felt in terms of both quality and equity that it's really important to keep our eye on this issue and make it a priority going forward.
My question centers around the residency programs and community health nursing. I'm currently a nurse at a local health department, and we find it challenging to recruit nurses, and especially nurses with a community health background and experience working with community partners. How do you see this working into those residency programs?
One of the things that has been a bit of a challenge related to the residency programs is that they don't mirror the physician residencies, and that they are post-graduate residencies in almost all situations. So the responsibility for the financing of those programs lies primarily with the employer. And so part of what we were recommending was that employers take a stronger role in looking at the residency programs and supporting those residency programs more broadly, because that has become kind of the responsibility, but also looking at the opportunities for some funding for that type of program. One of the primary another challenge of the residency programs has been the inconsistency in the different types. So it's been much more difficult to define specifically the outcomes. And so I think that for nursing in general, we need to come up with some standards for the residency programs, whether it's for post-baccalaureate or advanced practice nurses, so that we can have some consistency across the board.
We need to be preparing nurses more for a variety of roles as care is moving out of the acute care setting. The educational process and the preparation of the leadership needs to reflect that. So there was a very strong message that's comes out in several sections of the report of moving education out into the community more to prepare nurses for where care is going to be, and to prepare nursing leadership for where care is going to be. And that would apply to public health, obviously, strongly.
I'd also add that the committee did hear from one of our hearings, from a number of people who are involved in transition to practice programs, and we were impressed that there is a lot of activity going on, and it's a period that we should be learning about which programs are most effective. We also at times sort of wanted to pull back from the use of the term residency, because the residency program is so associated with physician residency and that methodology. And we're really talking about the transition to practice and that overlap between education and practice. So don't think of it just as residency as in the physician model, but think of it more creatively as that transition to practice.
I just wanted to hear a little bit more. I think you already started mentioning it, but as we think of the future of nursing, we do think about the importance of preventive health, population health, moving out of traditional health settings, and really looking at other ways of improving health before individuals and communities get sick in the first place. And I just wondered if you could talk a little bit more about how the committee considered that as they looked at the future of nursing and our role.
I will say that one of the tenets that we thought about in general was the changes in healthcare that have occurred since the report was originally published, and recognizing that the ACA has had a huge impact on healthcare delivery across the board. So even thinking about scope of practice and advanced practice nurses, I think there was primarily a focus on primary care, but now that the ACA has put more of a focus on population health, that even broadens the possibilities for advanced practice nurses. So I think that we looked at all of the recommendations in the context of an evolved healthcare system and the influence that the ACA has had on that system over time.
We were excited about the inclusion of all of our great work across our centers on our minimum data sets for supply, demand, and education data. And we were wondering if the committee had some thoughts about how we can continue to strengthen that, especially working with other organizations.
This is an area where the committee was impressed with the progress that had been made in data collection in the state workforce centers and the state action coalitions. clearly have focused a good deal of energy on data collection. I know there was a lot of frustration and disappointment that HRSA didn't do the National Sample Survey of RNs in 2012. They did do the National Sample Survey of NPs. The committee identified the fact that there's been a tremendous amount of activity around data collection, and we think real progress. Some of the important things are the American Community Survey, including data on nurse practitioners, and the Federal Medical Care Expenditure Panel Survey, including data on nurse practitioners and other advanced practice nurses. So I think there's been real progress in data collection. What's missing, and part of that is the absence of the National Health Workforce Commission, is some sort of structure or infrastructure to put all the pieces together. And so that one of our key recommendations is to suggest that the campaign can really play an important role in bringing the many diverse nursing groups that collect good data together to really see if we can build a national infrastructure for data. Clearly, the state nursing workforce centers are a critical part of that. They've really been in the forefront of encouraging improved data collection. So now the challenge is to build the infrastructure around all of those pieces.
You mentioned in one of your findings that you want students to be more aware of where they can go with nursing, not just in the acute care or even community, but lawyers or politics, stuff like that. And I love that idea, but the problem is that it's so hard to find a nurse that has taken that path and get in contact with that person. And I'm wondering if there is a site or a program that can be set up where nurses or healthcare professionals that have taken that route are able to reach out to students that want to know more about that.
Take advantage of every opportunity that comes along. Seek out people that you admire on your faculty or on other faculty, and ask for people's advice and help. Make yourself a mentee of those people, and keep your mind open to what the possibilities are. Don't make a premature conclusion about where you're going to end up and where you want to be.
Right.
The sky is the limit.
That's
Awesome.
right.
Thank you.
That's right.
This is the Campaign for Action, and I want to mention the Graduate Nurse Education Demonstration, which Victor Zhao raised originally, which is at Duke, Penn, Rush, and Cynthia's ahead of the one at Rush, Herman Memorial in Texas, and Banner Health in Arizona. And we have a 4-year demonstration that shows that it's feasible for Medicare to pay hospitals, to pay for the clinical precepting of advanced practice nurses, that we've more than doubled the supply of nurses, that over 60% of them are in primary care. We have done everything that needs to be done from a policy point of view, and so really we need the Campaign for Nursing Action and everyone else to build on this tremendous opportunity of the ACA demonstration to say we do need a Medicare GNE benefit. So Cynthia, since you're leading one of these, could you comment briefly?
To just comment briefly, I think that the recommendation from the campaign of gaining a broader coalition of supporters is going to be an important component of achieving what you just described. It has to be a broader coalition than nursing specifically, the other health professions as well as community leaders to help us to achieve that. But I agree with you.
So on behalf of the Future of Nursing Campaign for Action, we are indebted to you. We will follow your recommendations, and thank you so much for your time here today with us.